Career Exploration Project. The career that I chose is a neurodiagnostic technologist. Neurodiagnostic technologists perform tests that diagnose problems with the brain and nervous system and also sleep disorders. They use digital equipment to record electrical patterns throughout the brain and nervous system, which result in data that the doctor uses to diagnose and treat the patient. The data that is obtained through these tests can help diagnose conditions like epilepsy, seizure disorders, strokes, and degenerative brain disease. There are many different branches of this profession, and what I specifically would like to do in this field is conduct and read EEGs. This is a type of test that is used to assess brain activity. EEG technicians visit patients and conduct an EEG on them when they are needed. This is about a 25-minute test that includes putting 29 EEG electrodes on the patient and asking them questions and doing 2 hyperstimulation tests to see changes in the EEG. When the technician is not actively conducting EEGs on the patients, they do 4 10-hour workdays from home on the computer where they prune through EEG test results from patients all around the U.S. This means that they go through it and pick out parts that the doctor needs to review. Skills that are needed for this career that are very important are working well with others, social perceptiveness, active listening, and critical thinking. Since most of this job is dealing with patients in a hospital and working with other staff, it is important to be able to work well with others, have social perceptiveness, and be able to actively listen to everyone around you. Critical thinking is also important because there may be a time when a difficult patient will need an EEG and they would need to figure out how to make it work and conduct the test. Critical thinking also relates to having to look through all of the tests and find parts that are most important that the doctor must review. My strengths and traits. My Focus 2 results gave me many career options in the medical field. These were more complex career options such as pediatrician, gynecologist, and anesthesiologist. Focus 2 said that I have the values and personality for these careers, but unfortunately, I do not have the skills. Although this is true, neurodiagnostic technology is a much easier career than these, so I believe that I will perform well in this field. Based on my Strengths Explorer results, I am dependable, confident, and a future thinker. Future thinker doesn't really have anything to do with this career, but based on my interview and my research, being confident and dependable are both traits that are a must for this job. Education. To become a neurodiagnostic technologist, there is not really much education that is needed. The educational pathway includes completing high school and getting a GED, completing an associate degree, and then completing a neurodiagnostic technician certificate program. After this, a professional certification exam is needed, and then you are ready to become a neurodiagnostic technologist. My interview with Suzanne Wiggins. Suzanne Wiggins is a neurodiagnostic technician primarily at the Advent Health Hospital in Tarpon Springs, but she works in hospitals all over Pinellas when needed and sometimes even out of the state. I interviewed her via Zoom where I asked her 7 questions, but I will only be presenting the 5 that I feel are the most important. The first was, how did you get started doing this type of work? She explained to me that one of her friends had recently gotten a career in neurodiagnostic technology, and she thought that it was really interesting and decided to check it out, and then she started going to school for it and became one. The next question was, what are the employers typically looking for when hiring in this line of work? She replied that employers are really looking for is someone who is hardworking, can work well with others, and who are reliable. I relate to all of these things, so I would be the right person for the job. Next, I asked about what her favorite and least favorite part of the job was. Her favorite part is the flexibility and convenience of working from home, and her least favorite part is that she has to look at the computer for very long hours at a time, as she has 10-hour shifts. I would relate to both of these, but the convenience of working from home outweighs the inconvenience of working on a computer for long hours, in my opinion. Finally, I asked her what advice she would give to someone who wants to work in this industry. She explained how you have to be very detail-oriented and that you would have to be prepared to deal with all types of patients with issues, sometimes even very difficult ones. I'm very detail oriented, and I believe that I could handle that difficult part of the job. Overall, this interview showed me that I have the ability to work hard and become a neurodiagnostic technician. Thank you.